Hello, welcome back to the Health Revival Show. We are answering your questions today. So if you follow us on Instagram, the Poop Queen and the Hormone Queen, we will throw up question boxes very regularly. And because Instagram likes to not allow us to put so many stories up these days without penalizing our views, then we decided to bring some of them to the podcast. And honestly, some of the questions are just things that, we need to answer more in depth
Yep.
and, have multiple considerations for. So as always, before we dive into this is not medical advice. We're not your practitioners. We always support getting testing so that you can address things accordingly, right? And take into account your bio individuality, age, and gender of some of these questions we have no clue about. So we are going to dive in today, covering a couple of fun questions. So we're going to talk about itchy scalp. Specifically, this was around teen boys, but I think that this can be applied really to anyone. Pain after eating, being told by the doctor that it is SIBO, and what to do besides prescription pills. And then are GLP-1s a forever thing? So we're going to talk all about these, and I'm excited to dive in. So I'm just going to quickly cover the itchy scalp and talk about a couple of things that we would question and want to consider. And then we can talk about products and ways that you can address it. So anytime that we're thinking about this itchy, flaky, dry scalp, I'm not sure if there's discoloring, if it's red, if it's bumpy or anything like that. You always want to rule out that this is not something more serious like a fungal infection, a bacterial infection, a parasitic infection, right? We don't have no information here. Is this something that has recently popped up? And if so, I'm always thinking about what stressors have been present. Has there been a life change, a big schedule change, some sort of trauma? Have you moved houses? When kind of did this arise? If we're just thinking that this is more along the lines of that atopic dermatitis, more on the eczema side, I think that there's a few things that you can be doing. And number one is to make sure that you have a good quality water filter. So you want to have a good pH of your water. You want to get out chlorine and all these chemicals and heavy metals that can be very agitating and irritating to the scalp. And with our hair follicles and your hair in general, you want to maintain a good acidic balance. And so some people will err more on the side of, greasier, and some people will err on the side of, more dry. And so this is where you could start to look at the types of shampoos or conditioners that you're using. What you will see if you're looking at like a dermatitis or psoriasis eczema shampoo, that a lot of them are going to have specific, pH balances, and they're going to share there with you how it's, a little bit more neutral. For me personally, I love red light therapy. I love doing, and this is just what has worked in our household, and it worked very quickly. And I've had several people tell me that it's worked very well for them and their children. Is the H22 and H23 from Oliveda, their shampoo, and then the hair and scalp treatment specifically. So it smells amazing, but you put it on your scalp, let it sit for just a couple of minutes, rinse it off in the shower. Even one of my severe hair loss cases, we've done a lot on the peptide side and some other things internally to really help his hair regrow and come back full and strong. But he was still having flares of the psoriasis. And so putting that in, he told me one treatment, he noticed a difference. Within two, it was entirely gone. He has struggled since he was a teen with that. And he's now. All right, if you're dealing with water retention, you're waking up puffy, your ankles or your wrists are really swollen, or you can't get your rings off, and maybe you're even dragging throughout the day, no matter how much water you drink, there's actually a good chance that you're not actually hydrating properly.
Exactly, because water alone is not enough. You need electrolytes, you need sodium, potassium, magnesium, because those things actually pull water into your cells. Otherwise, you're basically just flushing it out and wondering why you're still tired, you're still bloated, and you're still sluggish.
But here's the thing, most electrolyte supplements out there aren't helping you in any way, because a lot of them contain things like natural flavors, food dyes, and maltodextrin, which can irritate your gut. And these things can also spike your blood sugar when you're trying to heal.
That's why we both started using Buoy. It's super simple, just trace minerals and electrolytes in liquid form. No flavors, no colors, no sugar, no sweeteners, and you squeeze it into whatever you are drinking. Water, coffee, tea, smoothies, you name it.
And it's clinically backed by science too. So studies have shown that Buoy helps you hydrate better, 64% better in fact, and that's data coming from key blood and urinary markers, not just marketing fluff. And honestly, you can feel the difference. I've had many clients tell me their digestion's improved, they have less headaches, and they're better energy throughout the day.
And Buoy isn't just for people that go to the gym all the time and sweat a bunch. They actually offer a 35% lifetime discount for anyone that's struggling with chronic illnesses. Things like POTS, Hashimoto's, Crohn's disease, chronic migraines, and every autoimmune condition. They're really committed to making better hydration accessible to people who need it most.
I actually throw it in my coffee every morning because it's such an easy upgrade. You don't even taste it, but you're definitely going to notice if you miss it.
If you're tired of playing hydration roulette and want something that actually supports your body, you've got to try Buoy. It's honestly one of the simplest ways to feel better faster.
Now in his 20s. So those are very affordable products. They're very simple that you can utilize. They also smell good. So I personally would start there. But if this again is something that is persistent or you're, seeing other symptoms, right? So let's say like athlete's foot or other parts of the body that are indicating more fungal infections like thrush, oral thrush, yellow tongue, or different things like that, then I think you should do some testing to see, are we dealing more on a yeast fungal infection? Obviously, if it's more bacterial, this is where we can see like that folliculitis. This can cause like more tender, itchy bumps. I think you would notice that on other parts of the body, not just on the scalp. So the last thing here is to always consider nutritional deficiencies and things that really help support that skin barrier. Skin is a 90% inside job, but especially when we think about the immune system and how your body mistakenly attacks the skin, because that's what's happening here. This is an immune attack against the skin, right? Altering that turnover, the skin turnover and response, we would go down to the basics, right? So here I'm going to think about cod liver oil, amazing for people who have keratosis pilaris, but you can also use that for any other conditions. And that's got a lot of good vitamins and minerals, essential fatty acids, vitamin A, vitamin E. Always think about vitamin D status. So getting your levels checked there, wanting to stay somewhere in the ballpark of 40 to 60. If you're autoimmune, I like it to be closer to 70. And then zinc can be amazing. And if he is a teenager, I'd direct you to something like a Mary Ruth Zink. She's got some great products for kids and teens.
Yeah, and for non-teen boys, hormonal shifts can be really commonly driven or drivers of itchy scalp because estrogen helps maintain tissue and collagen balance within the body. And so when you get big drops of estrogen, you can get a lot drier skin. You can get dry eyes. You can get all those different things. So that's another possible like root cause for people that aren't dealing with, yeast infections, potential nutrient deficiencies, allergies, right? Autoimmune. Those are kind of the big ones. But the hormone shifts are probably the main one that we haven't touched on. Obviously, hydration's extremely important. If you have dry skin, it's going to be itchy. So like you need to make sure that you're hydrated. Histamine is a big driver of this in a lot of cases. And with estrogen fluctuations, you can really trigger a lot of histamine issues because estrogen can stimulate histamine. And so that can trigger itching. Sometimes it's an easy thing to test, like take some Pepcid, take some Zyrtec, see if the itching subsides, then you know it's probably histamine related. The gut, we know, just a huge thing. And then overwashing or really hot showers because both of these will strip the oil from the skin, and they will also open up the pores and make them a lot more permeable for things like get in or get out or moisture get out, infections get in, things like that. So I know a lot of women, and myself included, sometimes like scolding hot showers, especially in the wintertime.
Mhm.
It is not good for your hair and your skin. So they can, even with hair loss, like they'll open the follicle too much and they can cause more hair loss. So hot showers are a big problem and it exacerbates skin
Yeah.
irritations, right? Like any inflammatory skin irritations are going to be worsened by hot showers.
Yeah, you bring up a really good point there. And so, kind of going back to the pH balance. So, on your scalp, you want it to be like 4.5 to like 6.5. And this is really important because again, it's a protective acid mantle. And so, like Becca was saying, like your scalp has this thin film of oils basically that form this acid mantle. And so that protects you. But if that's broken down or compromised because you're doing hot, water too hot, you're using harsh shampoos, especially ones that have a pH above 7. So that's where you're going to want to look at, what it says on the bottle or have to do a little bit of research on their website. They don't make it super easy to come across this stuff. Chemical treatments, right? So if you are bleaching your hair, you're using different dyes, you're using bleach in your so for example, we have white sheets, right? If I was bleaching them all the time, that could be irritating because we're going to lay on that. Specifically, if you have short hair, right? So I think about my husband. If I'm bleaching and then he's getting exposed to that through the pillow covers and sheets and things like that, that can um, irritate his skin. And then different relaxers. So if you are somebody who relaxes your hair, that can spike alkalinity. And then again, just overwashing. So for individuals with dry hair, dry scalp, you might want to be that person that goes multiple days without washing your hair. But again, like Becca was saying, anything going on internally in the gut microbiome. An acidic microbiome is going to help keep yeast under control. If it's more alkaline, it's going to kind of let those things grow. So lots of things to consider there, but I would certainly try some of those things in terms of what you're doing every day, right? Red light therapy can be very good too. But I would definitely say that starting with your water quality and then what you're putting on your hair, washing your hair with every day is going to be of utmost importance.
Yeah. So the next one question was around stomach pain after eating. The doctor thinks it's SIBO. What to do beside prescription pills? I'm assuming they're thinking like prescription antibiotics for SIBO, which I would not recommend. Um, we rarely do that. We have done it in rare cases, but it is never the first route. Um, and I would ask if it's immediately after eating or if it's a couple hours after eating, because I'm not saying that immediately after eating can't be SIBO. It's just not as commonly SIBO immediately after eating. You'll typically see, especially like if you think about when you consume food, it doesn't immediately go to your butt. Like it has to go through a process first,
Mm.
right? And so upper GI is a lot of times liver gallbladder. So there could be like a bile flow issue and gallbladder sludge happening, potentially even gallstones, especially if it's like a higher fat meal that you're getting this pain. You'll get it on the upper right side, or you can sometimes get it on your back, like your shoulder. Um, Ulcers are also a possibility. So, like gastric issues, this could be a gastric ulcer. So, I think if it's immediately after eating, I think inflammation. Like there's some level of inflammation in the tissue. And so it's hitting that and it's causing this pain. Pancreatic insufficiency is the other thought, is like there's a lack of enzymes there to help
Mhm.
with the breakdown of the food. So those would be my initial thoughts if it's immediately after eating.
Yeah, and I would just question, is this with everything, right? Like, is it certain foods that your body is reacting to? Because when we run a mediator release test, for example, this is looking at histamine, cytokines, a variety of chemical reactions that happen in the body as your body is breaking down those foods. I would also think the same thing in terms of the inflammation, right? So think of your gut as either an open wound or a house on fire, right? And you are just throwing agitation at that, like it's gonna be painful. The other thing, though, that I think about, just depending upon where it is in the abdominal, generally there's different sections. We have a whole blog and guide on this. Is Are you chronically constipated? Are you somebody who is dealing with a lot of left side? I'm hearing more and more left upper quadrant
Mm.
pain, which is really more of a spleen and a pancreatic issue. So this is really where I would support, because the spleen has to filter your blood. I would support doing blood work, or I would recommend doing blood work to check pancreatic function. You can also do this in stool via elastase, or we can look at it in blood, amylase, and lipase, and those types of things. And then, beyond that, thinking about what is your white blood cell count, your red blood cell count, are the indicators there of needing to support your spleen and thymus, in which there's a really great homeopathy. I have a client that's come in. She came in because of this left side pain. She's not had it since we started her on that spleen thymus tincture homeopathy, very gentle. And then the last but not least here is, kidney stones. I don't know if you touched on that,
Yep.
but if things are moving through, you generally are going to know that it's more along the line of the kidney stone because of where it's hurting. But I agree. I think that this is going to come down to, you've got a lot of inflammation in the gut. You've got some insufficiencies that need to be addressed. And by that, it's going back to what Becca said, like you don't have bile flowing in the right amount at the right time to help you break some of these things down, and or, pancreatic function, or digestive enzymes and stomach acid.
Yeah.
But
If it's chronic pain and you wake up with pain, you wake up bloated, that typically points more to a SIBO condition, um, because you're having like slower emptying and then if fermentation happens, gas gets
Mhm.
produced and then it can create pressure and pain. A lot of times people will feel that more like behind the belly button area,
Or
more like,
lower.
or middle, yeah, middle to lower area, in a true SIBO case, but you have to evaluate everything.
There could be abdominal pain on an empty stomach from H. pylori as well, but you're saying
Mhm.
this is specifically after eating.
Yeah.
And the other thing too is, like, how are you eating? Are you slowing down and chewing your food? Are you putting large particles? And this is hard. Like, I always say this every time as a disclaimer. I'm not here to throw glass at a rock's house. I don't chew my food as well as I should all
Mhm.
the time. And so that is something to really be thinking about. If you don't have any other things, I would also consider maybe looking into silent reflux, because that could be associated with this here. Again, if we're looking at more of that hernia or, ulcer. So if this is ongoing, highly recommend test and address this, right? So if they're saying SIBO, then ask them for a SIBO test.
Mhm.
The research is pretty clear that it's about 80% of the time the rifaximin dual triple treatment will work for SIBO, but 66% of the time it comes back. So you can see that it does more harm than good. And a lot of times people will notice that they feel better on the antibiotic and then worse after if it is a true SIBO case. Otherwise, you can use things like Candibactin AR and BR. There's research around that to show that it works very well. But then we have to consider what type of SIBO are we dealing with? That's another big question here. And what else is going on within the terrain in terms of is there H. pylori? Again, are looking at where this is at. This is way above this question. Get a scan done, right? You can get an endoscopy, you can get a colonoscopy, get a SIBO breath test, get an H. pylori test. If you're not getting help and they say everything is normal, but they still want to just put you on antibiotics and they're not digging deeper, like that's what we do in our practice. But for chronic pain, I always refer out to GI doctors because you don't want to mess with that, especially in this day and age with the rise in colon cancer that we are seeing.
Yep. So, last question. Are GLP-1s a forever thing? Cycling on and off for heart health and inflammation benefits. So, I do not recommend cycling on and off GLP-1s. I don't think that you should be like taking it for a month and off of it for a month and then taking, because what you're doing is you're jacking around blood sugars. So you either stay on them for a period of time that you need to utilize them properly. Do not, some people need higher doses and that's okay. We talk a lot around microdosing and I believe in microdosing, but I also believe in the fact that some people might need a higher dose for a period of time and that's okay. There's no shame in that. But you do want to get back down to lowest effective dose possible. And then some people do fine cycling off of them and maintaining the results. What I think I have found, we look at a lot of genetics. I think when someone has a lot of inflammatory issues in terms of their genes, they do well staying on low doses of GLP-1s. That is a trend that I have found.
But you can cycle them up and down in terms of dose, right?
sure.
So if you're at a good place right now where you feel good and you're kind of happy with your weight, your blood sugar's looking good, you're able to get into ketosis, meaning you're tracking ketones and you're doing some fasting and you're seeing that you're getting ketones, I'd say between a 1 and a 2 at least, then fantastic, right? Stay at this low microdose. We talked about this with Jay Campbell in terms of like a 12-month out of the year thing. Maybe that looks like you're doing 0.25 milligram 1 to 2 times a week. And then in other seasons where you decide either I want to shred a little bit more or I have played a little bit too hard and I want to reduce, a little bit more inflammation, work on fat loss and different things like that. Maybe you increase your dose. So you're kind of cycling up and down versus going off entirely. There's a lot of other peptides that can help with blood sugar and mitochondria and fat loss and all of these things that, we look at in terms of the GLP-1s. But generally, because those aren't the way that GLP-1 in terms of, gut health and like acromantia and the signaling, it is safer longer term to stay on some of those things versus like, let's say an AOD, right? An anti-obesity. It's recommended 8 weeks on, 8 weeks off, that you are cycling off of those different types of peptides. Whereas we're looking at the GLP-1, if you're doing these low doses, then you can stay on them longer and then you can increase your dose as you need to and decrease it as you need to as well. If you don't want to stay on them, then I think you just have to recognize based upon yourself, your lifestyle, your environment, how your genes play with our environment today. For example, like Becca was saying, if we look at a inflammatory gene page, maybe you're not using a GLP-1 any longer, but you want to switch over to something like an LDN to help keep inflammation and the immune system more, controlled and at bay. Maybe you're using other things like quercetin, pyrroliseed, urolithin A, a variety of other things to support your mitochondria. This is where, to be honest with you, and I think Becca would agree, can just get really complex really quick. And I'd rather just stay on a GLP-1 that's like, I personally have come to the point of like supplement fatigue. And if I can do an injection 1, 2, 3 times a week, I'm very happy with that. And then I keep my minimal things like my thyroid support, my vitamin D, my magnesium. I have a probiotic in place right now and some gut lining support. But outside of that, I'm like, I don't want to be on a bunch of different things. I really like the results that I'm getting with retatrutide. Some people do feel that their heart rate is increased too much, and so they're more sensitive to it, and they may go back to using something like a tirzepatide, and which if you're at a microdose, you don't have to worry about it too much. But if you're at a megadose, higher dose, whatever you want to call it here, like in the research, upper 15 milligrams of retatrutide, for example, you would want to titrate down and then switch back to like a tirzepatide. Or if you're on a semaglutide, let's say, and you're at 80 units a week, you'd want to titrate down and then switch over to tirzepatide. Some people don't do this. They don't, have people do that all the time. But from what we have learned in our experience working with a variety of very, very smart individuals that have a lot of experience with this stuff, that is going to be your best practice to titrate down and then switch over.
Yeah, I've had some people mix them. So I've had some people that are on like 7.5 milligrams of tirzepatide slowly go down while bringing in small amounts of retatrutide and then basically reversing them. And that has seemed to help as well in terms of ending up on a lower dose overall, ultimately,
Mhm.
because your body adapts, right? Your body is
Mhm.
going to create antibodies to anything you put into it. And so with a GLP-1, there is no exception there. Like if you stay at a certain dose, and everyone knows this that's been on it for more than, I would say, 6 to 8 months, the hunger starts coming back, right?
Mhm.
You aren't seeing weight loss. Like there is a plateau that happens at some point, which is why they are tools. They are not your savior. They are not going to keep you in, able to do whatever the hell you want and still maintain a healthy body and, body composition. And so you have to be intelligent about how you use them. I do think that it is fine to stay on these long term. As long as things are properly working otherwise. You are pooping daily, you are exercising, you are not losing a ton of hair, you are, maintaining muscle mass, you are eating adequately. Like you need to make sure that you have all of those other pieces in place. And the GLP-1, I see a lot of people, sadly, females, losing massive amounts of hair, feeling not great, and staying on them because they're terrified to gain weight.
Yeah, and I think too, one of the things that I cover in the GLP-1 guide, and even with talking, with Megan from Vital, one of our partners there, she's like, there's so many benefits here, and these really do help extend life. And so when we think about cardiovascular benefits, we think about benefits in terms of lowering triglycerides, LDL, oxidized, LDL. They are very helpful, and if they can be a longevity tool, then why not, right? But the caveat is when you are seeing these individuals who crank them up. Number one, the receptors burn out. And so then they're just not getting any results. And they're now at this really high dose. That's disappointing, right? Because they're wasting a lot of money. But number two is that they aren't doing the lifestyle work. So it is very true that you have the risk of nutritional deficiencies. And if you're at a risk, a greater risk of nutritional deficiencies, from whatever it is, a GLP-1, a birth control, a proton pump inhibitor, right? Let's just compare this to other things that people stay on for the rest of their life because they weren't told that they need to come off that proton pump inhibitor that suppresses stomach acid, reduces your ability to digest and absorb nutrients. Yes, then you are going to be at a risk, just like you are with GLP-1s, of thyroid dysregulation, hormonal, impairments, and then things like, bone loss and things like that. And it's not the GLP-1's fault. It's because the person utilizing this wasn't utilizing it properly. So you want to eat adequate levels of protein. You want to diversify your diet. You don't want to be severely under eating, just like you wouldn't want to be severely under eating if you were doing something like Weight Watchers or the HCG diet or whatever it is, fasting prolonged periods. This is where we come back to seasonality, diet variation, going through different seasons where you're eating maybe in a little bit of a surplus or at least at maintenance. Then you can come back into those seasons where you want to clean up that autophagy work, mitophagy work, right? Shed some fat, whatever it is, but you don't want to just stay in that deficit forever because your body will downregulate. And then that's when you're at a greater risk of having some of those negative side effects that everybody, is scared of when they're looking at the mass media and not looking at the research.